About health and life. Picture Cynthia, a busy social worker dealing with life's ups and downs. Suddenly, she's facing health problems like heavy bleeding and pelvic pain. It makes us wonder, what's going on? How many others are dealing with similar issues? Come along as we explore Cynthia's story and learn about the things that can affect women's health. Ever thought about how family history or everyday choices can impact our well-being? Let's find out together. Gonadotropin-releasing hormone, GnRH, agonists. These medications work by shrinking fibroids. They're sometimes used to shrink a fibroid before surgery, making it easier to remove the fibroid. However, these medications are temporary, and if you stop taking them, the fibroids can grow back. Oral therapies. Elagolix is a new oral therapy to manage heavy uterine bleeding in people. Another oral therapy, tranexamic acid, treats heavy menstrual bleeding in people with uterine fibroids. It's important to talk to your healthcare provider about any medication you take. There are several factors to consider when talking about the different types of surgery for fibroid removal. Not only can the size, location and number of fibroids influence the type of surgery, but your wishes for future pregnancies can also be an important factor when developing a treatment plan. Some surgical options preserve your uterus and allow you to become pregnant in the future, while other options can either damage or remove your uterus. Myomectomy is a procedure that allows your provider to remove the fibroids. There are several types of myomectomy. The type of procedure that may work best for you will depend on where your fibroids are located, how big they are and how many you have. The types of myomectomy procedures to remove fibroids can include hysteroscopy. Your provider inserts a scope, a thin, flexible, tube-like tool, through your vagina and cervix and into your uterus. Your provider uses the scope to cut away and remove the fibroids. Laparoscopy. In this procedure, your provider will use a scope to remove the fibroids. Unlike hysteroscopy, this procedure involves placing a few small incisions in your abdomen. This is how the scope will enter and exit your body. Laparotomy. During this procedure, your provider makes one larger incision in your abdomen and removes the fibroids through this one cut. If you aren't planning future pregnancies, there are additional options your healthcare provider may recommend. These options can be very effective, but they typically prevent future pregnancies. These can include hysterectomy. Your provider removes your uterus during a hysterectomy. A hysterectomy is the only way to cure fibroids. By removing your uterus completely, the fibroids can't come back and your symptoms should go away. If your ovaries are left in place, you won't go into menopause after a hysterectomy. This procedure might be recommended if you're experiencing very heavy bleeding from your fibroids or if you have large fibroids. Minimally invasive hysterectomies include vaginal, laparoscopic or robotic methods. Uterine fibroid embolization. An interventional radiologist performs this procedure with the help of your gynecologist. They put a small catheter in your uterine artery or radial artery and inject small particles, which then block the flow of blood from the artery to the fibroids. Loss of blood flow shrinks the fibroids and improves your symptoms. This procedure may not be right for everyone. Radiofrequency ablation, RFA. This is a safe and effective treatment that uses microwave, RF, energy to treat uterine fibroids. It's recommended for people who haven't reached menopause. It treats smaller fibroids. There can be risks to any treatment. Medications can have side effects and some may not be a good fit for you. Talk to your healthcare provider about all medications you may be taking for other medical conditions and your complete medical history before starting a new medication. If you experience side effects after starting a new medication, call your provider to discuss your options. There are also risks involved in surgical treatment of fibroids. Any surgery places you at risk of infection and bleeding, and includes risks associated with anesthesia. An additional risk of fibroid removal surgery can involve future pregnancies. Some surgical options can prevent future pregnancies. Myomectomy is a procedure that only removes the fibroids, allowing for future pregnancies. However, people who've had a myomectomy may need to deliver future babies via C-section. Doctor, how large do uterine fibroids need to be before being surgically removed? There isn't a definitive size of a fibroid that would automatically mean it needs to be removed. your healthcare provider will determine if surgery is necessary based on your symptoms. For example, fibroids the size of a small marble may still cause excessive bleeding depending on their location. Your healthcare provider can discuss symptoms that might require surgical intervention. Doctor, what happens if fibroids go untreated? If you don't have symptoms, treatment for fibroids may not be necessary. If you have large fibroids or your symptoms are causing you pain and discomfort, getting treatment may be the best option. Only you and your provider can decide the best course of treatment or if treatment is necessary. Doctor, can fibroids be prevented? In general, you can't prevent fibroids. You can reduce your risk by maintaining a healthy body weight and getting regular pelvic exams. If you have small fibroids, develop a plan with your healthcare provider to monitor them. Doctor, can I get pregnant if I have uterine fibroids? Yes, you can get pregnant if you have uterine fibroids. If you already know you have fibroids when you get pregnant, your healthcare provider will work with you to develop a monitoring plan for the fibroids. During pregnancy, your body releases elevated levels of hormones. These hormones support the pregnancy. However, they can also cause your fibroids to get bigger. Large fibroids can cause the following problems during pregnancy: increased risk for a C-section delivery because the fetus can't flip into a head-down position. Labor doesn't progress. Placental abruption. Preterm delivery. Doctor, can fibroids change over time? Fibroids can actually shrink or grow over time. They can change size suddenly or steadily over a long period of time. This can happen for a variety of reasons, but in most cases, this change in fibroid size is linked to the amount of hormones in your body. When you have high levels of hormones in your body, fibroids can get bigger. This can happen at specific times in your life, like during pregnancy. Fibroids can also shrink when your hormone levels drop. This is common after menopause. Often, your symptoms can also get better after menopause. Doctor, will fibroids go away on their own? Fibroids can shrink in some people after menopause. This happens because of a decrease in hormones. When the fibroids shrink, your symptoms may go away. Small fibroids may not need treatment if they aren't causing any symptoms. Doctor, do fibroids make you tired? Feeling tired isn't a common symptom of uterine fibroids. However, it's a common symptom of anemia, which can occur when you lose too much blood. Talk to a healthcare provider if you feel excessively tired so they can determine the cause. Doctor, do fibroids make your stomach big? Yes, it's possible that large uterine fibroids can cause your stomach to bloat or appear larger. Doctor, are fibroids cancer? It's extremely rare for a fibroid to go through changes that transform it into a cancerous, malignant tumor. In fact, 1 out of 350 people with fibroids will develop cancer. In a warm and friendly conversation, the doctor assured Cynthia not to be overly worried. There are ways to manage fibroids, including taking medicine, making lifestyle adjustments, or, in some cases, opting for a minor surgical procedure. The doctor discussed the rare chance of fertility issues, providing Cynthia with a clear understanding of her situation. With this newfound knowledge and a personalized plan, Cynthia felt more at ease, knowing that she had a knowledgeable and caring guide by her side. The doctor's explanations and support empowered Cynthia to face her health challenges with confidence, ready to navigate the path ahead with the assurance that she was in good hands. Ready to unlock more health mysteries and stay informed about your well-being? Subscribe now to join our community. Don't miss out on discovering the secrets of a healthier, happier